All right. All right, Ashley. We just took your vitals and have already identified who you are, um, and we've already given you privacy. And um, so I'm just looking up here on the doctor's orders, along with the vitals that he wanted us to do. He also wanted us to do head, ears, nose, and throat assessment, along with a cardio assessment and a respiratory assessment,
Mhm.
and then also a neurological assessment. Is that okay with you?
Yeah, that's fine.
Okay, perfect. So the first thing we're going to do, we're just going to do, normally we would do just a head to toe assessment, but since we're not doing a full head to toe assessment, I'm just going to start with your head.
Okay.
And so I'm just going to, if it's okay if I touch you,
Yeah.
I'm just going to palpate your head. Just her head is round, symmetrical. There's no drooping of either side. Is there anything tender when I'm pressing on your head?
No, it feels okay.
No tenderness. I don't feel any lumps, abnormal lumps. Okay, perfect. Have you had any headaches recently?
No, I don't believe so.
Okay, perfect. Um, the next thing I want to do is we're going to look at your eyes. And how we're going to do that, I just need to, I'm going to put this pen up. I'm going to see how, if you can just look straight at me. And so we're going to assess what's called perla. So your pupils are round. Um, and they're approximately 5 millimeters. And then I'm just going to see if they react to light. So I'm just going to flash this real quick. It's not going to stay there for very long. So I just want to see if your pupils do what they're supposed to do. Okay. Yes. So your pupils are reactive to light, so which is good. And then I'm also going to do what's called accommodation. And so what I want you to do is I want you to look at this pen and then pick an object behind me, um, and like, but keep on looking straight at me, but over my shoulder. If you pick an object over my shoulder, okay, perfect. So when you look at something close up, your pupils constrict, and when you look far away, they expand. So they're doing what they're supposed to be doing. So, have you had any vision problems or anything? Um, um, you've noticed like any loss of vision or everything's normal there? Okay, perfect. All right, I'm just gonna make some notes here that all that was good. Um, Next thing I want to do is I just want to look at your eyes or your ears. We already did your eyes. Um, and I'm just looking for your ears to make sure that they're symmetrical from your auricle down. So her ears are symmetrical. I'm just going to take a peek inside. And I just see a little cerumen, which is supposed to be nothing out of the ordinary. There. So that's good. And then we're gonna test your hearing. And what I'm gonna do is it's called a whisper test.
Okay.
So I'm gonna whisper two numbers, and I just need you to respond to me what those two numbers are.
Okay. 7 and 5.
Okay. Perfect.
5 and 4.
Okay. Perfect. All right. Awesome. So the next thing I want to do is I'm gonna ask you just to look up. I'm gonna look in the hairs of your nose.
Okay.
Okay. And her septum is non-deviated, so it's a midline. The mucosa is nice and pink, nothing of concern there. Um, so no deviated septum or anything like that. Have you had any recent nosebleeds that you're concerned about or anything like that? Okay, perfect. All right, so next I just want to look at your mouth.
Okay.
And if you could just open your mouth, I'm just going to look in. All right. And buccal mucosa, which buccal means your cheek, it's nice and pink. And if you could lift up your tongue. That's perfect. Nothing out of the ordinary there. Gums look tight to the teeth. All right, you can close your mouth. And then we're going to, I just want to look, if you could look up, okay, and your throat looks midline, your trachea looks midline, nothing of concern there. And if you could look to, so it will be your right, and I'm going to tilt you back 45 degrees and just look to the right. I'm just looking for what's called a jugular vein distension. And this is actually part of your cardiac assessment, but since we're inspecting or assessing your neck right now, I'm just going to do this to get this out of the way. If you could look to the left, and what this is a sign of would be any type of heart failure would back up into this jugular vein. But there's no signs of jugular vein distension. So. All right, perfect. And any problems swallowing or anything like that?
No.
If you could just take 2 big swallows, I just want to assess that. All right, no problems there? Awesome. All right. So the next thing I want to do, obviously you did part of the orientation. You said your name, you know your name. So we know where you're oriented and your level of consciousness. You've been talking to me and you're alert and answering questions. So, so the next thing I want to do is what's called a Glasgow Coma Scale.
Okay.
And what that's going to do is, so if you were asleep and I walked in and you were sleeping, I would alert you and ask you to open your eyes. And so we're looking for you to respond by opening your eyes. And that's the first thing on the Glasgow Coma Scale. And then the next thing would be so the next thing would be a verbal response, which you told me your name in the beginning of the assessment. So we know that's good. And then a motor response. So just moving your limbs. And so we're going to actually do a muscular assessment as well, a musculoskeletal assessment. And so you're going to be moving your limbs. So we know that is all intact. So, yeah. So now if you didn't respond to any of those, obviously we would have some concern there. All right. All right. So the next thing I want to go into is your cardiac assessment.
Okay.
And we've already inspected the jugular venous distension, which we know that you don't have. All right. And any chest pain at all? Okay. All right. So what I'm going to do is I'm just going to listen to your heart. I'm going to listen to your heart with the diaphragm.
Okay.
The other side is the bell of my stethoscope. And if I had any concern or we need to do a further assessment of your heart, we would check the same spots that I'm going to check your heart. We would check it for a murmur, and we would just hear a whooshing sound that would constitute a murmur, but we are not in need of that at this point.
Okay.
All right. All right, so I'm going to go to your second intercostal space, which is to the right of your sternum. And I'm just going to listen briefly. All right, I'm going to go to the left, and this is where your aortic valve is. Now I'm going to go to the left of your sternum. And this is where your pulmonic valve is. All right, and that's in the second intercostal space. So I'm going to go down diagonal to the third intercostal space right on your sternum. This is where Erb's point is, which is just another point of the pulmonic valve. And then I'm going to go down to your fourth intercostal space. And this is where your tricuspid valve is. Okay, and if you could just displace your breast up a little bit, I just need to get down here in the fifth intercostal space, and it needs to be mid-clavicular to hear your mitral valve. And this is also where your PMI is, the point of maximal impulse. And this is where I would take an apical pulse if needed for 1 full minute if I had concern or if you had an irregular pulse. Okay, perfect. All right. So I heard the S1 and S2 sounds of your heart, so that's good. All right, perfect. Next, I want to move to, so I'm going to check for edema in your forearms. And I'm just going to roll the sleeve up. No sign of edema in her right forearm or her left. And then I'm just going to feel her right radial pulse, +2. Her left radial pulse, which is a +2. I'm going to check her capillary refill, which is 2 seconds on both hands, or bilaterally. All right, and then we're going to go down to your feet, and I'm going to check your capillary refill here. 2 seconds, 2 seconds as well. I'm going to check your dorsalis pedis pulse, which is a +2, bilaterally. We're going to go to your posterior tibialis, which is right beneath your heel bone. That's a +2. And that's a +2 as well. All right. And the other pulses that, if I couldn't feel your pulses there, I will go to your popliteal pulse, then move my way up to your femoral pulse, and then you have a radial, which I've already checked, and you have a brachial artery here where I would check a pulse. You also have an axillary pulse, and then you have a carotid pulse. Okay. And then let me check for edema on your lower limbs. Okay. No sign of edema on her lower bilateral legs. Okay. Perfect. I just want to go into your respiratory assessment and any shortness of breath. No problems breathing. Okay. And so every time I touch you with this diaphragm of my stethoscope, I just need you to take a deep breath. I'm just going to listen to your lungs, and I'll let you know when to stop.
Okay.
Go ahead and start breathing. And this is your right upper lobe, and I'm going to move over to your left upper lobe. All right, I'm just going to move straight down to your left lower lobe. And over to your right middle lobe. All right, and if you could just cross your hand over your chest like this, and I'm just going to check your right lower lobe lateral. Continue to breathe. Okay, and if you could take your left arm, and yeah, perfect. And this is your left lower lobe. Perfect. All right, I'm just going to check your posterior, the posterior of your lungs. And so I'm going to start on your right upper lobe. Then move over to your left upper lobe. Then straight over your scapula down to your left lower lobe. And then over to your right lower lobe. Now, any coughing recently or anything like that?
No, I don't think so.
Perfect. So the doctor just wanted us to educate you on a couple things. First of all, let me get a spirometer.
Okay.
And so this spirometer, what it's used for is to help expand the lungs and to help with the alveoli, which is responsible for the exchange of carbon dioxide in your lungs.
Okay.
And so what you want to do is use it about 10 times a day, 10 times an hour. So you're going to pretty much for 10 hours a day, 10 times an hour. What you're going to do is take a deep breath into your lungs and then blow into this machine right here.
Okay.
And it's called an centospirometer, and that just exercises your lungs and helps to expand them.
Okay.
And then the other thing that we're going to do, and I'll take that from you, is whenever you, we're in flu season still, so if you do ever get congested, a great thing to do that I want to educate you on is called turn, cough, and deep breathe. And so pretty much what you would do is you would turn your head, cough, and then take a deep breath. And that will help loosen up any anything that's in any mucus or anything that's in your chest.
Oh, okay.
All right, any questions there?
No, I don't believe so.
All right. Just want to make sure that I have not forgotten anything. Oh, you still have to do your musculoskeletal. So, couple things. Let's see here. All right. So the first thing I want to do is we're going to check two joints on your lower extremities and then two joints on your upper extremities.
Okay.
Okay. And so the first thing I want you to do is, so we're going to check your knees. So I'm just going to put my hand, if that's okay, on your joint right here.
Okay.
And I just need you to extend. So we're in an extension right now. And then flex. Extend, flex. Perfect. There's no signs of crepitus, which means any crackling or anything of the joints. And we're going to do the same thing here. Extend and flex. Extend and flex. No signs of crepitus bilaterally. The other thing we're going to do is we're going to do the ankle. And so we're going to flex and then extend. Flex, extend. No signs of crepitus. Let's see. All right, flex. All right, no signs of crepitus there. And then, so we're in extension right now. And so I'm gonna test your elbows. We're gonna flex, extend, flex, and extend. All right, no signs of crepitus. Flex, extend, flex, extend. And then we'll do radial. So this is your radial bone and this is your ulnar bone. So we'll do radial deviation. And so turn. And have you felt any pain at all in any of these exercises?
Yeah.
All right, no signs of crepitus. All right, same thing here. We're going to do radial deviation, ulnar deviation. All right, perfect. And then, let's see. And then what we can do is with your shoulders, we can do, so we're going to do abduction and adduction. Ab away from the body and add towards the body. No signs of crepitus. And then ab, add, ab, add. And then we're going to so we're going to hyperextend. So I'm just going to bend your arm back. All right, any pain?
I can feel the tension in
Okay,
my
but no
back.
pain?
No.
Okay, perfect. And then that's extension. And then we're just going to, this is circumduction. Any pain?
No.
All right, no crepitus. All right, and we're going to do circumduction. All right, perfect. All right, and then we're going to check your gait and how you walk. So if you could stand up.
Okay.
All right, and the first thing we're going to do is we're going to check your balance. So what we're going to do is we're going to have you close your eyes. Okay? And for 5 seconds. 5, 4, 3, 2, 1. So what we're looking for is if you were swaying or anything, that would tell us that your balance is off. But you did no swaying at all. So,
Okay.
And then the next thing is I just need you to walk. I'm gonna watch your gait, which that's just watching how you walk.
Okay. So this
And
way.
just straight towards that wall.
Okay.
Just so I can watch your gait. All right. There's no signs of limping or any signs of pain. And it's a normal gait. Nothing to be concerned about there. All right. And any of your joints that we just worked on or walking, any trouble getting around or any pain in any of those joints?
I guess pelvic floor muscle hurts a little bit.
Okay. Perfect. I'll put that in your notes so we can take a closer look at that. Other than that, any other questions or concerns for you today?
No, I don't think so.
Okay, you can have a seat,
Thank
and
you.
I'm going to go and put all these notes into your record. And then this concludes your assessment for today. And have a great day, Ms. Reed.
Thank you. Yay.